Hi, I am back from a little vacation, and boy, there is a lot to talk about. So let's start with the latest executive order, the Delivering Most Favored Nation Prescription Drug Pricing to American Patients order, which was signed on May 12th. This was splashed across the headlines as a big win, which would bring our prescription drug prices in the United States down from 60 to 80%, with President Trump saying in an interview that we should see those price decreases almost immediately. But will we? Let's take a look what's actually in the order. Well, number one, they asked the Secretary of Commerce to work with foreign nations and basically ask them to change their policies which limit the cost of prescription drug prices in their countries. I think that's highly unlikely. Maybe they'll make some headway there. It certainly won't be in the next few months. The second thing the order does is it directs the Trump administration to facilitate, within the scope of the law, direct-to-consumer sales at most favored nation pricing. It's not clear how that would work, and it's not at all clear that there is any ability within the scope of the law to tell pharmaceutical companies, which are private companies, how they have to price their drugs. Third, the order asks the Trump administration to take 30 days to determine what most favored nation pricing would be on a large variety of drugs, and then to communicate those price targets to pharmaceutical manufacturers. It's not binding, it's nothing they can enforce. Four, and this is something that may become actionable fairly quickly, it calls for allowing the importation of pharmaceuticals into the United States from companies with lower drug pricing. So for example, many drugs we buy in the United States are cheaper in Canada, Mexico, and we would be allowed to import their drugs here and take advantage of their more favorable pricing. Fifth, it instructs the Attorney General to pursue prosecutions for any pharmaceutical companies that engage in anti-competitive pricing tactics. It's just asking the Department of Justice to prioritize those types of cases. And finally, number six, it instructs the Food and Drug Administration to revoke approvals for drugs that might be unsafe or ineffective. So again, that's not something that is, and I'm uncertain that will have much of an impact on prescription drug costs in terms of covered services, because drugs that are unsafe and ineffective probably are not covered by your health insurance right now. So is this one going to be a win? I think we have to wait and see. It's possible that they will now go and negotiate a whole bunch of things which will strongly benefit American consumers and bring drug prices down. But just on the face of it, the order itself doesn't really do anything that will guarantee those lower drug prices. So, I think we'll count this as a win when we see prescription drug prices coming down.